In this video, let me discuss about the characteristic features of anatomical site of LMN weakness. LMN lesion occurs secondary to involvement of the following site: anterior horn cell, roots, plexus, peripheral nerve, myoneural junction, and muscle. Approach to weakness involves three basic questions. 1. True motor weakness or not. 2. Localize the lesion. And 3. Identify the cause. Characteristic features of anterior horn cell disease are: it is characterized by a pure motor involvement. There is no sensory involvement. There is patchy affection of muscles and fasciculation of muscles can be seen, and there is marked atrophy of muscle. Polyradiculopathy is characterized by motor and sensory affection. Here, the weakness occurs in myotomal distribution. The plexus lesion is characterized by more sensory involvement. The pattern of involvement neither in the distribution of root or nerve. There is no root pain, no paraspinal spasm. Typical example is plexitis secondary to infections and inflammations. The peripheral nerve lesion is characterized by LMN weakness in the distribution of peripheral nerve, and there is more distal involvement than proximal involvement. Sensory loss occur in the distribution of peripheral nerve, so it is more in the distal part of the body. It is associated with hyporeflexia and disturbance of autonomic nervous system. Another site of LMN lesion is myoneural junction. A myoneural junction weakness is characterized by diurnal variation, fatigability, involvement of cranial nerve affection, and absence of wasting. So there is more proximal involvement than distal weakness. No muscle atrophy is seen in a neuromuscular junction disorder. Bulbar and ocular involvement can occur. The last site is muscle. The muscle involvement is characterized by muscle pain, muscle hypertrophy, myotonia, cardiac involvement, and gastrointestinal muscle involvement. So, there is more proximal involvement than distal involvement. There is mild or no atrophy of muscle, no sensory loss, and there is normal or decreased deep tendon reflex only in the distribution of weak muscles. These are the characteristic features that help in localization of an LMN weakness. Thank you.